Lyme disease, an illness spread by ticks, has seen significant growth in Ohio over the past 15 years and is also gaining newfound attention after singer Justin Timberlake shared his own diagnosis in July. Nearly 1,800 cases of Lyme disease were reported in Ohio last year, and there are already close to 1,200 cases this year. Almost 1/3 of those were in Northeast Ohio. The Ohio Department of Health says Lyme disease cases are increasing as the habitat range of black-legged ticks expands throughout the state, particularly in forested regions. Local infectious disease specialist Dr. Dee Banks joins me now to discuss the rise in cases and how to spot symptoms of Lyme disease. Dr. Banks, welcome.
Hi, Derek. Thank you for having me.
So can you tell us a little bit more about what Lyme disease is and any long-term risks it exposes people to?
Yes, well, Lyme disease is a disease that's carried by as you said, the black-legged tick, which we tend to see more of in Ohio. And, you know, over the years, as you have said, that we've seen, and certainly I've seen personally, an increase in the number of Lyme cases coming in the hospital. Lyme can go the gamut in terms of how it can affect you, you know, from really having no symptoms or no diseases at all to really becoming quite devastating for patients who get it. It can involve your central nervous system, your heart, and actually, interestingly enough, we've seen an increase in Lyme carditis in this area over the last several years. So it's really quite alarming to see the uptick that we're seeing now in Lyme disease. The hallmark of Lyme disease is what we call a bullseye rash, where there's a reddish area with a reddish circle around it. But it doesn't always have to present that way. So the other symptoms can be a rash or arthritis, which can really go along with a lot of other things. And as I always say, you have to have a high index of suspicion. And certainly now, since we're seeing an uptick in tick disease in this area.
Is early detection important with Lyme disease?
It really is, because it can, you know, like I said, it can go from not having any problems or symptoms at all. A lot of times it's treated with an antibiotic that your physician will give you, or an emergency room, or your primary care physician, or your infectious disease doctor. And generally the treatment is about 10 to 14 days. But if it becomes if it becomes worse, let's say your central nervous system or your heart, then it's going to require more than pills, and then you'll need intravenous antibiotics for a longer period of time. And then also there are those patients that go on to develop the chronic sequelae of Lyme disease, with chronic fatigue and tiredness and all of that that's associated with that sequelae of having Lyme disease.
How can people protect themselves?
Well, the best way to protect yourself is really prevention. Wear light-colored clothes when you go out into a wooded area so that you'll be able to see the ticks when you come inside. Wear permethrin treated clothes that really prevents ticks from attaching on to your clothing. And then use repellents, not something that you go onto Google and just find, but use those repellents that are the EPA approved, with DEET. There's oil of eucalyptus if you don't want to use DEET on your children. You just need to be vigilant. Vigilance is probably the operative word at this juncture.
Absolutely, that is the key word. Dr. Dee Banks, we appreciate the expertise as always.
Thank you. Thanks for having me.